My name is Christina Kwok. I am a fellow at the Center for Universal Education here at Brookings. And it's my pleasure to welcome you all here as we launch our report and a forthcoming policy brief, both outcomes from a research collaboration that we did with the Michelsen Institute. So today's presentations and panel are a continuation of discussions that we've had here at Brookings over the last couple of years, examining girls' life skills education. I think many of you in the room today are probably very familiar with the concept of life skills and the broad impact that it has on girls' lives around the world. While it has become a regular part of our toolbox when working with marginalized girls to help improve their life outcomes, there have been very few cross-country studies that actually look at the design and the approach to life skills programming in non-formal learning environments. So our first speaker today is Kendra Dupuy, a senior advisor and researcher at the Michelsen Institute and at the Peace Research Institute in Norway. And she'll be presenting the findings from our research, which aim to explore the landscape, the design, and the intended outcomes of non-formal life skills programs in Ethiopia, Tanzania, and Lebanon. So if you will all join me in welcoming Kendra to the stage.
Okay, thank you very much. And I would first of all like to thank Brookings, and particularly Christina and Helen and your team for an excellent collaboration and all your work and patience. So thanks a lot. And there's a lot of people here, so thanks for coming very much. Especially I traveled a long way from Norway, so it's always my fear to show up to an empty room. Okay, so yeah, as Christina said, I'm Kendra. I have a funny last name, so just call me Kendra. And I come from a research institute in Norway called Michelsen Institute. And I wanted to just tell you briefly about this institute because it is very small and you probably have not heard of it. It is a small, well, small compared to Brookings, small research institute based in Bergen, Norway, on the beautiful west coast of Norway. And we are an independent social science development research institute. We carry out applied research for policy influence, and what we're primarily concerned with is how to reduce poverty and improve human rights in developing countries. We carry out research that involves both quantitative and qualitative methodologies, and we have an interdisciplinary research staff from many social science disciplines and humanities. We have expertise in a number of areas, so including poverty alleviation, health, education, gender, anti-corruption, resource management, and public financial management. So together with Brookings, we collaborated to produce the report that I'm going to present today, and which is found online. And the main point of this report was to look at the current state of non-formal life skills programs that serve adolescent girls in low and middle income countries. So we had three more specific research questions, which were, first, what is the landscape of life skills programs for girls in developing countries? How are these programs designed? And what outcomes do they intend to achieve? So what was the motivation for this study? So our background research told us that there are few existing studies of what types of non-formal, and by non-formal I'm talking about the non-formal education sector, so what types of non-formal life skills programs that exist specifically for girls in low-income countries, low-income, middle-income countries. So these programs should be quite good for girls because girls, they're living in contexts of poverty, often lack access to school and to good quality schooling, and are discriminated against. So these programs should be quite valuable for them. And the non-formal sector is a key arena to reach disadvantaged girls in these contexts. But we found very few cross-country studies of these types of programs, and there are very few existing rigorous evaluations of their impact and their design. So we wanted to know more about what's really going on in this field. So I want to take a moment just to set the ground here, to lay out the ground in terms of what we mean by life skills. And this was one of the first things that we found out, that there is no agreed upon definition of what life skills means. Now, there are accepted and widely used definitions of life skills, but no one has decided that this is it. So in the report, we put forward a definition. And we say that life skills is the combination of skills, or what one has, knowledge, what one knows, and attitudes, what one believes, and values that constitute a set of competencies, what one can do, that enable youth, oops, there's an extra two in there, that enable youth to adapt to, function, and thrive in society. They enable individuals to translate knowledge and attitudes into specific behaviors that allow young people to cope with, navigate, and transform life's challenges. So maybe just a summary is to think of them as competencies that transfer to other situations. And often in the literature, they're sort of put in this bucket of everything that's not academic, therefore it's a life skill. So different types of life skills, there have been some categorizations across these different definitions of life skills we located in the literature. So one grouping are social and interpersonal skills. So these are about relationships with other people. How do people manage those relationships? This includes qualities like having respect for other people, an ability to work in teams, being tolerant, being able to cooperate, communication skills, and conflict resolution skills. A second category is what we're calling personal skills. So it's this management of yourself, including emotions management, self-regulation, perseverance, self-confidence, and self-awareness. And a final third category are cognitive skills. These are analytical abilities. So things like problem solving, goal setting, future planning, organizational skills, critical and creative thinking, decision making, and something a little bit more specific, health skills. So how did we carry out this report? So we had a mixed methods approach that proceeded in several stages. So first of all, we carried out a comprehensive literature review on this topic, and we came up with quite a number of documents that we reviewed. We then went out and collected original data in 3 countries. This was Ethiopia, Lebanon, and Tanzania. And the reason we suggested those, selected those countries was that the team of researchers involved from my side at CMI have in-depth knowledge of these countries. And then also, these are countries in which life skills programs are prioritized by the government, and I'll talk more about the countries and the specifics on that. And there are NGO programs specifically that are life skills programs. So we knew we would have data. And so our data collection methods, we first mapped out existing life skills programs that target or involve girls, and we found 103 programs across these 3 countries. We then conducted a survey of program beneficiaries or participants and program administrators. So the survey, ultimately, the sample was 779 adolescent females and 54 project managers across the countries. And we focused on programs where life skills are taught through youth clubs as a way to focus our data collection and ensure that we found something consistent over the 3 countries. And finally, we had a small number of qualitative interviews to follow up on the survey, and this was about 30 participants. Okay, just briefly, what did we find in the literature review? So besides the lack of a definitional consensus, there are a few existing rigorous evaluations of programs and their impacts, and they generally show positive outcomes for female participants. And these outcomes are many and varied, but evidence has been collected and generated for several different outcomes, including psychosocial and attitudinal outcomes. So for instance, changed views on gender roles and improved self-confidence. There is evidence that life skill programs help to increase and improve health and sexual and reproductive health knowledge and practices. Evidence that life skill programs help girl participants to improve relationships with spouses and community members. Evidence that these programs have led to prevention and reduction of early marriage. And finally, that they have helped female participants to improve their economic and cognitive skills. So we have grouped our findings into 3 areas of inquiry that match, of course, to our research questions. So first of all, in terms of program landscape, this question we have about program landscape, so the specific questions that we asked in this area were, what kind of non-formal life skills programs are being implemented in developing countries that benefit adolescent girls? Who do they serve? And what teaching methods do they use? Okay, and our first finding was that the programs on which we collected data, they don't always serve the most vulnerable, nor do they exclusively target girls. So how did we define vulnerability? So this we defined as if a girl was orphaned or disabled or a dropout from school, poor, displaced, and or not living with their parents. So once we took those factors into account and looked at what kind of participants were in these programs, we concluded that they are not serving the most vulnerable. 84% of the programs in our sample are serving both boys and girls, and they recruit any and all youth. They generally don't use any background criteria other than age. Many of the participants were recently in school, and about 40% of them, when we asked how they found out about the program and why they enrolled, said they were contacted by an NGO, which suggests that either youths that are in school or have recently been in school are a fairly easily identifiable group for programs to recruit into their programs. Our survey respondents and their parents are generally educated, literate, and they are not disabled. And only 10% of programs, when we talked to them, stated that they specifically target vulnerable youth, and that just 2% actually went out and targeted vulnerable vulnerable adolescent girls. Okay, but there was a bit of variation by country. So we found in the case of Lebanon that nearly half of the Lebanese survey respondents, these are program beneficiaries, can be considered vulnerable according to our definition. This dropped to 39% in Ethiopia and 29% in Tanzania. But when we looked at citizenship status, we were kind of curious about this, given the context of Lebanon, which has a lot of refugees. So when we factored that in as an additional characteristic of or an additional indicator of vulnerability, the number went up considerably. And many of these programs are targeting and involving, serving adolescent refugee youth. So 88% of the respondents then were considered vulnerable. But when we did the same for the other countries, this did not change, despite the fact that there are, of course, refugees in these other countries. So, what kind of teaching methods do these programs use? So the vast majority of them use participatory and interactive teaching methods. Things like discussion, role play, drama, art, writing, sports. And program beneficiaries stated they were very satisfied with these methods. So that's really great. 75% of the programs say they use trained instructors and that they themselves actually train and regularly evaluate the instructors. And in the report, we give examples of the ways in which they train and follow up on instructors. It was actually, there were a lot of practices. It was quite interesting. Programs claim they are regularly evaluated and that they collect participant feedback. And 70% of our programs stated that they involve community members in implementation, and about half actually asked for parental consent for program beneficiaries to participate. Okay, in terms of program design, so what do non-formal life skills programs teach and why? And does context, by which we mean political, social, and economic context, shape the content of programs, and does it influence what is taught? So the programs that we collected data on report that the most commonly taught skills, or the most commonly skills that they most commonly teach are social and interpersonal skills. So this was about 45%, nearly half of the sample. Fewer teach personal skills, health skills, cognitive skills, and very few teach vocational skills, perhaps because vocational skills are often considered separate, but not always. So in general, program content we found is largely aligned with participant desires, what participants wanted to learn. So Ethiopian and Lebanese survey respondents, so the girls taking part in the programs, stated that social and interpersonal skills were actually the most important things that they learned in these programs. So largely a good synergy between what programs are teaching and what girls want. Just to give you a little breakdown across the countries, so about 60% of programs in Lebanon are teaching social and interpersonal skills, and a little bit less in Ethiopia and Tanzania. For personal skills, so about 28% of programs teaching in Tanzania teaching personal skills, 19% in Ethiopia, and just 12% in Lebanon. And so going back to my previous slide about the match between participant desires and what programs are teaching. So we did find a bit of a mismatch in Tanzania. So in Tanzania, just 14% of the programs we collected data from reported health as being one of their top taught skills. But 46%, nearly half of the beneficiaries, said that that was the most valuable thing that they learned from these programs. So this is something that girls really prioritize, yet programs report there's low reported teaching of these skills. Okay, and our final area of inquiry was, what's the point of it all? What do these programs intend for girls to learn and for the outcomes to be? So, of course, we asked programs what they intended to do, what they do, why they did things, but we also asked girls for what they thought the intended impact would be and how they anticipated the program would result in change for them. So we found that participants felt like they would have a better chance at using the skills and knowledge and things they learned in these programs in areas where they could exercise high areas of agency. Oh, should I put that on or no? Okay. All right. Extra technology. Okay. So participants felt like they would have greater gains in areas where they had high levels of personal agency as opposed to areas where there are larger structural barriers. So what does that mean? Girls reported that they felt like the training would have a high impact on their relationships with other people, on their personal and emotional skills, so for instance, their self-confidence, and on their health knowledge and health skills. But they largely reported that the life skills training would have quite low impact on things like future employment, marriage plans, and taking on leadership roles. But there was some variation in the countries that I thought I would share with you. So across the 3 countries, 86% of our beneficiaries saw a high impact on emotional management. 94% of them really felt that life skills would help them with self-confidence. Even higher number on respect for others, health choices, and education not far behind. But in terms of marriage choices, just 49% across the sample of beneficiaries felt like life skills training would actually have an impact on future marriage choices. And this dropped to 27% in Tanzania, 59% in Lebanon, and 64% in Ethiopia. And just 73% felt that there would be a positive impact on future employment choices. So these are areas where girls may not be able to exercise much agency or choice, no matter what kind of life skills or what quality life skills education they get. So in general, the participants that we surveyed are very satisfied with their programs. They view training as being very relevant to their current needs. They rank the practical usefulness as being very good or good, and they often, well, almost always said they would recommend the training to others. And participants prioritize attending the program. So we asked a lot about, are there obstacles? Do you pay for transportation to come to these training programs? And the participants on average reported very few obstacles to attending. Even if they had to pay for transportation, they said, I still prioritize this and I still come. A lack of time was actually the most frequently cited obstacle, as opposed to money. Okay, let me give you just a quick glimpse into these three countries because they are quite different from each other, and each had some interesting things that came forward. So Ethiopia has a national framework for life skill training, and they've also designed a training manual for implementation of this framework. In this framework, they emphasize 4 categories of skills for life skills. So personal, interpersonal, group, and societal management. We found in Ethiopia that many of the programs are being implemented in urban areas and that few target girls or specifically vulnerable social groups. Many of the beneficiaries are currently in school in Tanzania, or they have recently received education. So as opposed to the framework, the national framework, the programs that we surveyed reported that they taught health most frequently, followed by social and interpersonal skills. Okay, so what did the girls say in Ethiopia? So just 2 highlights here. So the interviewees, the qualitative interviewees, when we talked to a few girls after the surveys, reported that they had experienced improved self-confidence, communication skills, and health knowledge as a result of participating. And they really liked group discussion, especially for taboo gender and sex-related issues that aren't allowed to speak about maybe in other settings. Okay, in Lebanon, also, there is a national framework for, it's a regional framework, for life skills. It's called the Life Skills and Citizenship Education Framework. And it does specifically say that life skills should be targeted to disadvantaged adolescents. And here they emphasize 12 core skills, as opposed to Ethiopia, where it was 4 sets of skills. So a third of our programs that we surveyed in Lebanon teach more than 10 skills at one time. That's a lot, but they teach more than 10, mostly falling under social and personal skills. No programs in Lebanon reported explicitly teaching on sexual and reproductive health, and only a few actually reported teaching on health at all. 20% of the programs in Lebanon targeted girls only, and 60% targeted both boys and girls. And as I mentioned earlier, a greater number of the sample respondents were actually, could be considered vulnerable. And the majority of the participants in Lebanon, when we surveyed them, are recent school dropouts. So this is probably not surprising since probably many of them are refugees. So, and there are significant problems for getting into formal schooling in Lebanon. Okay, what did the girls say in Lebanon? So survey respondents said that social and interpersonal skills are the most important things that they have learned, and they reported positive changes in social relations and sociability. And interestingly, they said that many times they had been encouraged to take part in their training by family members and community members, suggesting that that's actually really important that programs involve communities and families in implementation. Finally, Tanzania also has a national life skills framework, which emphasizes things like self-awareness, social and relationship skills, and cognitive skills, and it's very preventatively oriented, meaning that's, we would speak more about that in the report. All of the programs in Tanzania included both boys and girls, and just slightly more than half the sample of beneficiaries are currently attending school. Survey respondents find health skills very valuable, like I stated before, but very few programs are actually teaching health skills. So interestingly, in Tanzania, when we asked girls about life skills and what was useful for them, they started talking about vocational skills and how vocational skills, and equated this with life skills and how useful vocational skills were for them. But in general, they saw life skills training influencing their future employment and education opportunities, and that may be in part because of this conflation with vocational training. And they said that they had experienced positive changes in social interactions. Okay, so to wrap it all up, I think one of the advantages or the contributions of this report is really to lay out a new research agenda for this area of life skills for girls. And I myself think that we suggest a number of research areas in the back of the report, and I've lumped these into three. Not that I think they're interesting, and so maybe that's why I put just three up here, but I think we suggest six. So the first is why and how do programs have an impact? So there's evidence they have an impact, but we want to know more about how and why. So how do girls learn skills and how do they apply them in real life? How do the various dimensions of program design and the theory of change influence outcomes? So we didn't find any studies that really specifically looked at program design and connected that to program outcome. So is skill acquisition and application of a function of skill interdependency? Many of these programs are teaching 5, 10, 15 skills together. And so it could be interesting to know more about, do you need to teach several skills together in order to see some kind of outcome? And then obviously looking more at how context shapes outcome and impact. A second area of research could be looking more at program recruitment methods and the incentives aligned with that, and whether that changes the beneficiary profile or whether very vulnerable girls might simply select themselves out of these programs and that it's not necessarily a recruitment problem, but that remains to be seen. Finally, and this is my pet rock, so looking more at the connection between formal schooling and non-formal life skills programs. So girls' education is on the world policy menu, and we know that the largest gendered gaps in access to primary and secondary schooling are in conflict-affected and very poor countries. And in the existing literature, there is evidence to suggest that life skills programs may help girls to stay in school, to re-enroll in school, and to improve their academic outcomes. So just an example of this, in Lebanon, one of the girls that we conducted a qualitative interview with said, "Many girls like me, after attending the program, have had a chance to return to education." So, and we also found that the girls that we surveyed, those that had more formal years of schooling completed, felt like their life skills training would have a greater positive impact on their future choices. And just thinking back a couple of slides, a lot of these girls also said that they felt like they had high control over future education choices. So in this sense, life skills training could really contribute towards improving formal schooling outcomes for girls. I will conclude there.
Thanks for watching. Be sure to like and subscribe for more videos from Brookings.